Respiratory 102. Blood gas analysis. The 6 blood gas indications are to evaluate ventilation, which is the CO2 levels. Check the acid-base balance, which is pH. Check the O2 status, which is the PaO2. Check their O2 carry capacity. Assess their response to therapy, in which case you would determine if the device is working or they need more O2 or a different device. And monitor the severity and/or progression of the disease. More commonly in code or critical patients. Arterial puncture sites. Arterial blood is used because it is a reflection of the overall cardiopulmonary status. The 3 sites of puncture include radial, brachial and femoral. Radial artery puncture, which is located on the thumb side of the wrist, is the most common used. 3 advantages is that it is easy to assess and palpate, contains collateral circulation, which is a mix of radial and ulnar, decreases the chance of nerve damage and vein puncture because there are no large veins near it. 2 disadvantages is that the artery is small, so it requires practice, and it is hard stick if the patient is hypovolemic, hypotensive or has a low cardiac output. Brachial artery puncture, which is located on the pinky side in the elbow crease. 2 advantages is it is a large artery and easily palpated. 2 disadvantages is it is close to large veins and nerves and there is no collateral circulation. Femoral artery puncture, which is located in the groin area and is mainly done by doctors. It is the best option if the patient has hypotension, hypovolemia or a decreased cardiac output. This is very true on patients receiving CPR. 2 advantages is it is a large artery and easy to palpate. 3 disadvantages is it is deep in the body, close to major veins and has no collateral circulation. The modified Allen's test should be done before an Abg draw. It determines ulnar artery circulation adequacy. If it is a positive test, it confirms collateral flow. If negative, you should try the other arm, and if still negative, then try the brachial. The modified Allen's test process. Have the patient hold their hand above their heart and make a fist. Then block their radial and ulnar arteries for 30 seconds. Have the patient then open their fist and release the arteries. Their hand should go from pale to pink in 1 to 2 seconds, but 5 to 10 is still okay. Arterial sampling. In a hub flash, arterial blood will come quick and be bright red. But venous blood will come slow and appear dark. The volume needed to draw is between 0.5 to 1 ml or cc. 0.5 is enough for just an Abg. Volume dependence include the anticoagulant and analyzer type used and if it is needed for more than one test. Ways of avoiding pre-analytical errors are to ensure the sample is obtained anaerobically, properly anticoagulated, by which the needle should be heparinized. The sample should be analyzed within 15 minutes. And it should be checked for coagulation on the tip of needle. Errors of Abg. Bubbles cause the PaO2 to increase and PaCO2 to decrease. Because of this, bubbles should be expelled immediately, or if there are too many you should redo the draw. Delays are, and if it is longer than 10 minutes it should be put on ice, but if it is delayed longer than 15 minutes you need to redo the Abg. Excess heparin can cause the pH and CO2 to decrease. Abg contraindications include a negative modified Allen's test. If the patient is undergoing dialysis. If the patient is on medium or high-dose blood thinners. And if there has been recent O2 changes, you need to wait 30 minutes. Abg complications include bleeding, air emboli, hematoma, which is a disruption of flow, pain, arteriospasm, in which case a jerk could cause the artery to roll, and nerve damage, which is rare. Documenting includes date and time, the patient's set FiO2, their respiratory rate, their temperature, current ventilator settings if applicable, the puncture site you drew from, and the modified Allen's test result. Indwelling catheters are mainly seen in ICU. They provide a readily accessible blood draw and continuous vascular pressure monitoring, but are more prone to infections. They can be inserted in peripheral arteries such as radial and brachial, which is the most common, or femoral artery, central vein and pulmonary artery. RTs can draw from the radial, brachial, and femoral, and nurses draw from the central vein and pulmonary artery. The pulmonary artery may also be used to administer meds with a second line. Capillary blood gases are usually for infants and taken from the heels, which should be warmed first. They are used for pH and CO2 but not PaO2. Most common errors are from not pre-warming as well as squeezing blood out. Other error factors include poor blood flow, air in the sample, and heparin not being mixed well. Capillary blood gas indications include abnormal non-invasive readings, arterial access is unavailable, a change in patient status, the need to monitor the disease process, and assessing therapy, in which case is CO2 increasing. These next slides were not in her lecture and she said no calculations for this quiz, but they were on the PowerPoint, so the A gradient is used to diagnose the hypoxemia source. Normal is 25 to 65 torr. AVQ mismatch is 66 to 300 torr. And shunting is more than 300 torr. The PF ratio is used to determine acute lung injury or acute respiratory distress syndrome. Normal is 380 torr and up. Acute lung injury is less than 300 torr. And acute respiratory distress syndrome is less than 200 torr.